So the tool that we use during the hospital stay is called the Finnegan scoring tool. This was named after Dr. Loretta Finnegan, and it helps healthcare workers assessing withdrawal and signs and symptoms in opiate-exposed infants. And there's 21 different withdrawal signs that we look at, and we assess and score them throughout the infant's period of withdrawal. And we start this Finnegan scoring at age 3 to 4 hours. So when the baby is born, 3 to 4 hours later, we will start scoring him or her, and we will come up with a score every 3 hours. So here's an example of the scoring system, and you can print this out from your handouts. A copy of this scoring system is given to all families, and we explain the scoring system. So these babies are on a strict 3-hour schedule for feeding, and we actually have a little clock that we put on the top of their bassinet with their schedule on it. We definitely don't want to identify these babies as having an opiate exposed family because many of these moms have not told anybody. So just having the clock on the bed with the baby's feeding schedule is a reminder to our nurses that these babies need fed and scored every 3 hours. And you can see there on the scoring system that each of the parameters is given a score from 1, 2, or 3 every 3rd hour, and at the bottom we add them up. So the total abstinence score is determined by adding the score assigned to each symptom observed throughout the entire scoring interval, which lasts from the beginning of one feed to the beginning of the next. So how we determine that is feed to feed. And it's recommended that scoring begin when the infant is at least 2 hours old, and then, like I said, we started at 3 to 4 hours, and they're scored every 3 hours. So how do we know when to score a baby? One time we would definitely begin scoring a baby is when there's known or suspected maternal drugs of abuse. And since we've had our transition coordinators seeing these mothers in the OB offices, we know many of these mothers, whereas before they were very hard to identify. Maybe the mother is in current treatment for substance abuse. Maybe there's been a positive neonatal drug test or a maternal drug test, which we do drug test all of our labor patients as well. And they have signs and symptoms consistent with NAS. So maybe a baby is born and the nursery nurses will notice that he or she is scoring high on the Finnegan, even if we hadn't officially begun to score them. So any known or suspected newborn with neonatal abstinence syndrome is kept in the hospital for 5 days after birth so that we can do this scoring system. And we would continue this scoring every 3 hours for a total of 5 days. And that's in accordance with AAP guidelines. And the AAP is the American Academy of Pediatrics, who is kind of the guru of all things peds. So scoring, what's this scoring all about? We talk to the parents about scoring and we try to explain why is it important. Crying. Now we know it's not uncommon for a healthy full-term baby to cry. But in general, during periods of crying, a normal infant will use self-consoling measures and self-soothe, like they'll try to suck their finger or their fist. And usually they only cry for 15 seconds or less. Or if when they're crying, it's time to eat, or they may have a dirty diaper or some other reason to be uncomfortable. But if the infant cannot use self-controlling measures, or even interventions from the caregiver, like holding and rocking these babies, or even a binky if that's required, sometimes that can be a sign of neonatal abstinence. These measures will usually assist in comforting the infant unless they're really hungry or in pain or having major discomfort. So excessive crying is a sign that we watch for. The next area is sleep. Newborns should sleep most of the day except when they're hungry. But we score one of the next 3 items in sleep based on how long the baby sleeps. Did the baby only sleep 1 hour after a feed, 2 hours, or did the baby sleep for the full 3 hours? So in a deep sleep, normal babies will have irregular respiration, so it looks like they breathe a little bit and then stop. Their eyes are closed, and they don't move except for maybe some startles, which is normal. Now, in light sleep, the baby exhibits irregular respiration, just like we talked about, maybe even some sucking movements, and occasional movements and eye movements. So deep sleep and light sleep is what we should see most babies in for at least 2 hours after their feeds. And I'm talking about newborns. Now the Moro reflex, there's a picture of a baby down there in the corner with a Moro reflex. That's a normal startle reflex. and it tells us about the infant's central nervous system. So in order to elicit the Moro reflex, we would lift the infant slightly off the crib by his wrists or arms and allow him to gently fall back into our hand. And when we do that, you will notice that the baby's arms will come out into a C position, kind of like they're grabbing up into the air. That is a normal Moro reflex. So when that reflex occurs, like that picture in that baby, the elbows will move away from the body and they'll extend their hands and wrists. An exaggerated Moro reflex, the baby will do that and hold that position and continue to tremor for about 5 seconds. Normal Moro reflex, the baby will tremor 1 or 2 times and then go softly back to sleep or back to his position of comfort. Tremors or jitteriness are synonymous terms. They're defined as voluntary movements or quivers that are rhythmical with equal strength. And for example, they will quiver their arms or quiver their legs. These types of tremors are scored on the Finnegan scoring session. Now, when an infant is asleep, a few jerking movements is normal, just like with adults, and we don't score those as tremors. Tremors are repetitive motion, and the tremors might be induced by stimuli, like if we touch them or unwrap them, but it's important to assess for tremors disturbed and undisturbed. So we will actually look at the baby while he's sleeping before we wake him up to score him the rest of the way, because we need to score tremors that happen when the baby is disturbed differently from tremors that happen even when the baby is asleep or undisturbed.